This morning is Module 2 of the online databases training, and the focus this morning is on the health databases, and there are 3 of them. So we're going to be going over the basics of what each one can provide, how to do basic searching, using all the different ways to search within them, and what they can provide for the public. So in this presentation, we're going to have an overview of all 3. The first one we're going to go over is Consumer Health Complete, which is probably one of the most heavily used of the 3 health databases. And then we're going to take a look at Cochrane Library, and then we're going to go over Santé en français. I do want to touch on one thing this morning. I'm going to be going through the presentation. You guys are welcome, if you wish, to open the internet and have a look at the databases while I'm talking if you want, but there will be screenshots throughout the presentation that explain what I'm talking about as well. And Cochrane Library is still down. It went down sometime last week, I believe. There's a notification about that on all our different web pages on our website. So if you, at the end of the session, if you're keen to get into the exercises, just remember you can't do Cochrane until it comes back up. So I don't know when it might become available, but it'll be around. All right, so of the 3 databases, 2 are in English and 1 is in French. Consumer Health Complete and Cochrane Library have their content in English. Santé en français, as the title would indicate, is in French, although there is English content in there as well. So we'll touch on that more when we get there. All right, so we're going to dive right into Consumer Health Complete. So Consumer Health Complete provides convenient access to easily understandable health and medical information. I really like it in my experience working at Reference. This is a great one to turn to for people who just need basic health information. They don't need to dig into like huge scientific articles or things like that. They've come in because I'm getting a pacemaker. I want to understand what that is, or I may have type 2 diabetes. Can I learn a bit about what it is and causes it? So it's not something that you'd have to be in med school to understand the articles. So you can use it to search and browse within medical encyclopedias, popular reference books, and magazine articles. The big thing about Consumer Health Complete is it offers authoritative information on health-related questions. So it's more reliable than simply plugging your symptoms into Google, which will then tell you have cancer, because that's all Google ever does. So using this resource, you can find nutritional guidelines, search for the latest articles on current treatments within specialized publications. They deal with general health, nutrition, healthcare, and most everything is full text, and it does also include abstracts of the articles. Most stuff I've found in here is mostly full text, but the abstracts are actually very good for the health databases because you can read them quickly, and then they let you decide if the information in the article is really what you're looking for. So it's a little different than a general interest database like getting a news stream, right, where you might want to see the whole article. With a medical one, you may want something very specific, and the abstract will tell you right off, so you don't have to dig through the whole thing. So there is machine translation to French and other languages for the database interface for Consumer Health Complete, but the informational content is just English, and it is a machine translation, so it's not going to be perfect for the interface, but it is there. Now, so that was Consumer Health Complete. We're going to come back to that and go more in depth, but right now we'll touch on what the Cochrane Library is. So Cochrane Library provides reviews on the effectiveness of a wide range of healthcare treatments. Each review has a plain language summary, which is exactly what it sounds like. Not going to dig into the heavy medical terms that may be confusing to people. And then it concludes whether or not a treatment has been effective. Cochrane Library is really full of, it's really good for people who are researching, treatments for things. Maybe not an explanation of what something is like Consumer Health Complete, but you can go a little further with it. So it's useful when you want credible information and opinions on healthcare treatments. It offers reviews on their effectiveness. The Cochrane collaboration produces the content of this database. The Cochrane Collaboration is an international nonprofit organization made up of health professionals, researchers, translators, and worldwide consumers who volunteer their time and efforts to the development of the resource. So what's in here has been reviewed by an actual credible organization about treatment that you're looking at. So that's what Cochrane is, but again, you won't be able to look at it today since it is still down. I will say Cochrane is good as a supplement, perhaps, to information you pull out of maybe Consumer Health Complete. I wouldn't turn there first when doing research unless your patron or yourself already has a lot of knowledge about the topic and is looking for more, or may have come in specifically, I've heard about this treatment, is there any information out there about it? Then yeah, I would go into Cochrane first in that case. But other than that, I would use it to back up the information I get. But again, that's entirely up to you. That's just been my experience using it. It has a lot of really good knowledge, but someone just walking in looking to start, I wouldn't go there first. And finally, our third one is Santé en français. So Santé en français contains evidence-based health information and hundreds of plainly written, so easy to understand, reports on the most common health questions. The articles in this database are written and revised by experts in the medical field. So their language is simple and easy to understand, and it also offers an interactive map of the human body, which you'll see screenshots of coming up. Which will help the database's user find full text articles related to every part of the body. It's quite useful, and you'll see that as we go on. So this database can be used to research common medical procedures and conditions in simple, easy to understand language. So in that way, it's quite similar in a lot of respects to the content you might get out of Consumer Health Complete, things that would be easy for a lay person, a patron to understand. But of course, as its title implies, the content is French. So we're now going to dive into an in-depth look at the three databases, now that we've kind of covered what they are and what they do. And we're going to start with Consumer Health Complete. All right, so this database has a lot in it. The types of information available, you can see this is a screenshot taken directly from the database itself. So it contains evidence-based reports, encyclopedias and reference books, fact sheets and pamphlets, news and magazines, drug and herb information, alternative sources, images and diagrams, and videos and animations. So there is a lot of stuff in here that we would never be able to have in print. We simply wouldn't have the space for it. There's entire medical encyclopedias that might take up a lot of shelf space and we could never keep up to date, and it's in here. So there is a lot of really good information right off the bat. Also a lot of magazines that we might not necessarily be able to carry in print are in here, and they're both more specialized ones and big popular ones that you might see at the newsstand. You know, Men's Health or Yoga or Fit Pregnancy or whatever, like ones you would see out there. They are available in full text through this database. All right, there are a lot of search options in Consumer Health Complete. There's a lot of different ways to get at the information that you want. So we're going to break down the 5 ways to go through it. There's screenshots for everything, and that way you'll be able to see how you can access it and choose the way that would be best for you. So we've got browse popular sources, basic and advanced search, the quick find option, search by category, and search by topic. So we're going to jump in to browse popular sources. So you're seeing a screenshot here taken from Consumer Health Complete. This is the only way to browse the Consumer Health Complete collection of magazines. They call it popular sources, but they are medical magazines, basically. So you would go in here and then click on the advanced search from there. You can see it marked right there. Okay. And then once you're in there, there's the publications function. So it is there. You have to do a little digging to find it, but it is in there. And then that way you could browse a list of the magazines. So some of the magazines that come from Consumer Health Complete can also be found on the NBPLS catalog. You can see right here, this is a screenshot of a magazine that somebody somewhere in NBPLS has in print, and there is a link provided right here, available in full text through Health Source Consumer. If you click there, it's going to take you to the online databases page where you can log in. So that's very, very useful as well. So again, that's the browsing the popular sources so that you can get in and see all the different periodicals that are available and simply browse through and read them that way. So, first one. I have, of course, basic search and advanced search. For a basic search, you only need to enter 2 or 3 keywords in the find field, and then you can click on search. You can see that right here. Here's the find field. Search is right there. The drop-down menu starts to suggest search terms once you have typed a few letters. And this only works in English, so typing the French name of the what you're looking for won't provide this drop-down here. So, which is very handy because then you may, like a very broad one like diabetes, suddenly starts to break down into other things. So you might be able to narrow down your search right from there. But the advanced search allows you to narrow your search by document type. So you could narrow it down only to looking for articles on diabetes that appear in encyclopedias and reference books, for example. And then you can say, well, I don't want news and magazines or alternative sources. I only want this. You can just click those off and get just exactly what you want. It's also possible to limit your results to include only those with full text. And that, of course, will lead you to not have to sort through anything that is abstract only. You will just simply get the full text. So that is probably I find basic search is probably one I would use the most in here because it can really get you started, and you'll see as we go into some of the other searching that there's other ways to kind of go off of that, but it's a really good starting place. And then usually after that, I would narrow it down to a certain type of result after that, like only the encyclopedias or only the magazine after I did my search. But there's also a very handy function called Quick Find in Consumer Health Complete. So Quick Find is available on the main page. You always see this alphabet right here, and it does pretty much exactly what it describes. If you click on a letter of the alphabet, it brings up a list of conditions and medical procedures that relate to that letter. It's always accessible right on the right-hand side of Consumer Health's Complete homepage. So, for example, D, diabetes, you can click on H for hypertension, or B for breast cancer, or whatever you were looking for. You could click there, you'd find it on the list of alphabetical, and then you could click that topic. It would take you into all the different types of results on that, and you could narrow it down from there. So very handy. And they also have search by category. So this just basically means you're searching only one type of document category. So again, this is always on the main page here. Clicking on, for example, images and diagrams only, then we would do that. Or, for example, drug and herb information, then you're searching only within that topic. So if you plug diabetes in after you've clicked drug and herb, you're only getting results that deal from diabetes from that perspective. Search by topic and Health Pilot. So search by topic is located at the bottom right-hand corner of the home screen here in Consumer Health Complete, and it allows you to browse articles on various aspects of health. So it just basically suggests things you could look at. So for example, you could click on, if you just had a general interest or wasn't sure what to look for on mental health, you could click there. It's going to take you into resources that deal specifically with that topic, and you can go from there. So it's just one more way to get in. It's always difficult to know. Some people want very specific information, and they'll give you exact keywords. Sometimes a patron may just want to browse and see what's out there on a topic. This might be a good way for them to use it. And right above the search by topic section on the home page, you will find the health highlight. section. In it, an article will be highlighted depending on the season or month, so that changes throughout the year in the database. It can be ranging from ADHD to UV Safety Awareness Month. It could be, in February they might have heart information up, in October breast cancer. It would depend on what they were promoting at that time of year. So that's always right there. Now, just to have a look at what results look like. We've gone through all the different ways there are to actually search for information in Consumer Health Complete. Now we'll have a look at what your results page actually looks like when you've done your search. So the list of articles right here. If your keywords generate too many search results, you can narrow them by subject or publication. There's your subjects right there. You can say, okay, I only want to deal with blood sugar. Let's get articles just on that. Or I only want a certain publication that they're drawing from. They're listed here. The search results screen right here also gives you direct access to advanced search. If you hit refine search up here, then you can go in, add more keywords on to narrow things down. Because one thing about searching for medical resources is there's a lot of results. There's no question of that. So narrowing things down, having the option to do that is very, very useful right here. Now, once you've found an article of interest, so say you want this one right here, which I'm not going to try to pronounce, and you've clicked on that, and you want to read the full text, you clicked on it, you can, when it opens, this is what you'll see, and then you can go in further, and there's a great function called Find More Like This. So if this article has interested you, you think, I would like to get more information that's like this one I'm reading, click on Find More Like This, and it's going to bring up a list that deal with that same topic, have those same subject keywords. So, really handy little function. All right, so on the results page, so I'm going. So a full, both HTML full text and PDF full text are available in this database. If you don't see either listed, underneath the article, you can see right here, this says PDF, and this one here doesn't have any HTML or PDF listed. That means only the abstract's available. So, but a lot of stuff in here is in full text. So an HTML full text will simply have the text of the article. It'll be there in its entirety, but if there were any accompanying photos or pictures that went along with that article in its print form, they're not going to be there if it's just the HTML version. But the PDF full text will have it, because that's been scanned. It'll pop open in Adobe. You'll have your full, exactly as it appeared in the print version. So that's actually really nice, something to watch for if you or your patron is looking specifically for something to get a little more visual on. PDF is a good option there. So one thing to note about Consumer Health Complete is that there are embargoes of a year or more on some of the journals and magazines. So information might take a little while to come in. It really depends on the journal, what deal they have with Consumer Health Complete. I think it's just the nature of the field. I mean, there's delays on most everything, as we touched on in Module 1, news stream and things like that. They have a day delay and so on and so forth. So I think everything probably going to have a little bit of a delay of some kind. So. All right, now there are a few little other bells and whistles in Consumer Health Complete, and there is a medical dictionary right up here at the top of the screen. You can see it's marked in red right there. So it does exactly what you would think a dictionary would do. It'll define a term that you're looking for. So arranged alphabetically there, or simply type in what you're looking for, hit search, it'll define the term. Very handy if you're reading an article in here and you're just not sure what a certain word means. Then you can just pop it into the medical dictionary and away you go. So that is the basics of Consumer Health Complete. I usually turn to this resource first when a patron would approach the reference desk with a medical-based question, because you're going to be able to get good, solid information that is peer-reviewed, that is safe, much more so than simply turning to Google. And it will be in a format that the patron can easily understand and can be easily printed, sent to them, whatever is needed. So yes, so that's Consumer Health Complete. Now we're going to take a look at Cochrane Library. All right, so Cochrane Library is really good for answering questions that people may have, because it'll take you to a review of a treatment or something like that. So we've got some examples here that if someone came in with such a question, Cochrane Library may be able to find a certain review of a treatment for that. You know, like someone coming in with a question about quitting smoking. Do nicotine replacement therapies actually work? You could go into Cochrane, find reviews of actual trials or tests where they have looked at that, and if the medical community says yes they do or no they don't. Now one thing about Cochrane Library is the results and the interface are in English only. So anytime you find any of this information, it is only going to be in English. All right, so I'm going to touch on search options in Cochrane Library. So Cochrane Library's search bar is right here up in the upper right-hand corner. It's right there marked in the red box. And the browse function and the advanced search function are right here immediately below the search bar. So that is, Cochrane's a very simple, straightforward type database, I find, for the most part. Say, hit search, you get your results. All right, if you don't know which specific medical intervention you're looking for, you can browse by topic. They do have that available to see what research has been done in the field. The topic section is located at the bottom of the home page of Cochrane's homepage. There's the topics function. So you can see here it's all listed alphabetically. So yeah, say for example, a patron came in and they had some questions about different treatments that are available out there for their kidney disease. They've tried a few, things aren't working. You could hit topics, hit kidney disease. You're going to find out what research has been done so far, and maybe that's something they can take back to their doctor and say, hey, I've heard about this trial. This is what it says. And you could go from there. So that's where Cochrane can kind of come in and supplement information that people already have. All right, Cochrane Library includes a special collections section, and that combines content from the Cochrane Library. As we know, that's produced by the nonprofit Cochrane organization. And also it'll combine that with external sources, which of course they have checked and consider useful. So that's available right there. Available, they have certain topics, you can go search it from there. All right, so this is what the results screen looks like in Cochrane Library once you have done search. So our example here is we have done a search on diabetes, and we have our results here, our different reviews, and we're highlighting right here specifically this very long, fancy research. You can see this is definitely not something I might hand to someone who doesn't know anything about diabetes right off the bat. But it would be good for someone who's, maybe they know more about it, have had it for a while, and they might be interested in what this study is right here. Now, a full text result in Cochrane is identified by a little open padlock. See that right there. So if you see that on your results, you know you're going to be able to read the entire review. It's not just an abstract, it's the whole thing is right there. So that's important to watch for. A little open padlock. So the information is there, it's not locked away. All right, and there are some fun extras in Cochrane. They publish a series of podcasts that can be accessed directly from the Cochrane Library website or downloaded from iTunes. Podcasts are free, and some of them are available in French, not all, but some. So that's something that honestly I wasn't too familiar with Cochrane before starting the research for these. I didn't realize they had done that much work in that. So something to have a look at or test out, depending on what health topic you're interested in. So again, that's the basics of Cochrane. Use it to supplement people's research, your patrons' research. Again, not something I would hand immediately to a layperson, but very useful for adding on supplementary information, or someone who may come in, I've heard about these trials, or I'm looking for more information on a treatment for my particular illness. Then yes, definitely dig into Cochrane, because they're going to find information they could easily take to their healthcare professional and go from. All right, so that is the library. But just remember, can't get into it today. So we've gone over Consumer Health Complete. We've gone over the Cochrane Library. Now we're going to touch on Santé en français. And in advance, if I accidentally mispronounce any of the search terms and things in Santé en français, I do apologize. All right, so the home page, actuelle, for Santé en français consists of 4 main sections. This is what the home page looks like when you open it, right here. And we break it down into 4 parts. The top part right here, all right? So it has, of course, the site's logo. It has the search field here, and it has a link to the advanced search option. Okay, so that's the top part. Then we have the left column right here, quite large. All right, so this is the first level of navigation here. It has affiché tout, which is a list of all topics covered by Santé en français. It also has affiché tout en anglais, a list of the topics available in English in here, because there are some. And it has parcourir, which is browse. And that's where we're going to touch on that clickable map of the human body. I mentioned that back when we were kind of just initially touching on the 3 databases, but we'll get further into that. So far we've got our top place just to search, browse. Then we have this bar right here, this right column. So this is the next level of navigation, rechercher par rubrique, search by category. Oh man, I mangled that terribly. And finally, on the bottom, underneath here, this is simply the interesting facts about health. So it's simply supplementary information. Go click and browse or read at your leisure, as opposed to digging into the research. So 1, 2, 3, 4, right there on the main page. All right, so we'll touch on Recherche Avancée, advanced search. So this allows you to narrow the fields in which your search is conducted. The search can be limited by the part of the body you're looking for, as well as by the document type that you're after. There's where you can enter your search terms. Here's the document types. You can specify if you're looking for information on just everything, or a specific condition, or a procedure that treats a certain condition. So there's a lot of different options to do that. I do like all the function that can let you narrow it down to a particular body part. That's quite interesting here. Right. So that's the search. Now, parcourir la planche d'anatomie, the anatomy board. So this is really good. When you click on a part of the body that's shown on one of the 2 profiles here of the human body, a list of symptoms or medical conditions connected to this part of the body will appear in a window. So then you click on a link of interest to find more on that information. So very handy, like someone say, well, my knee is hurting. Click on the knee, and then you will find a list of the conditions connected to that, and you could find more information. So it's kind of, I found that quite interesting, actually, to be able to click on, especially for patrons who are more visual or may not be able to express exactly what's bothering them, but they know it's my head, it's my wrist, it's my arm. and then they can narrow it down. Or if it's internal, click there and get a list of all the different organs in that area and try to narrow it down. Afficher tout. All right, so this shows you all the topics available in the database. With this search, similar to the topic search that we've seen in Santé, Consumer Health Complete, sorry, you can simply choose your illness, condition, whatever you're looking for from the alphabetical list. The alphabet's right here. Click on what you need. But of course, everything's arranged in French, which is nice here. However, if you do need to search by English, there's Afficher tout en anglais. So if you switch over to that tab, then everything is arranged by its English name as opposed to its French name. Which could be useful if perhaps the patron is more familiar in one language as opposed to the other, but may want to read it only in French or something like that. So that is an option in Santé. Now, options de l'article, article options. Certain articles offer the user the option to navigate to articles which have the same keywords and treat similar subjects. That's very similar to Consumer Health Complete, See More, where it links you out to find more like this. Basically, the same thing, or very, very similar. So if you're already in and you found some results you like, you found an article that you like, if you click on that, it's going to take you straight through into more articles that deal with the same topic.